Thank you for joining us. You are a part of an elite group who recognizes that Black women's health should be at the forefront of the national conversation. We are mothers, daughters, activists, entrepreneurs, entertainers, corporate warriors, and more, who help boost the economy and often drive the national conversation. For 38 years, the Black Women's Health Imperative has strived to amplify our voices, help enact policy that protects us, research our issues, create programs that enhance our lives, and produce events like this one to ensure we keep the conversation going about the issues that matter to us most. So, let's get started with our program.
Good afternoon. I'm Leslie Foster, and on behalf of the Black Women's Health Imperative, I am excited to welcome you to our Endometriosis Equity Leadership Virtual Conversation, Be in the Know, Centering Endo. So endometriosis is one of the leading causes for fertility in Black women. There is no cure for endometriosis, and Black women are only about half as likely to be diagnosed. This chronic disease causes a myriad of symptoms that can cause long-term negative health effects. It can impact a person's quality of life. It could contribute to extremely painful and abnormal heavy periods, spotting or bleeding between periods, chronic back or pelvic pain, constipation and or diarrhea, nausea, and potentially endometrial cancer, which Black women are nearly twice as likely to die from than white women. Communities of color nationwide continue to face racial disparities within our healthcare system due to provider stereotyping, cultural barriers, communication difficulties, inadequate health coverage, lack of information, and more. And the delays in diagnosis can be significant, and they can increase the probability of avoidable, negative, and occasionally fatal outcomes. So it's imperative that we advocate, that we educate, that we move forward, that we create safe spaces, particularly for Black women battling this disease. Now, before I introduce our panelists, I'd like you to know that the Be in the Know Centering Endo conversation has two parts. So if you'd like to contribute your thoughts, experiences, your research, and your knowledge, Black Women's Health Imperative will be hosting a Twitter chat centering endometriosis tomorrow on the BWHI Twitter account starting at 12 o'clock Eastern Standard Time. The organization is going to conduct a conversation via Twitter about much of the information that we share today. So you can stay today and come back tomorrow. There will also be other facts and resources, and BWHI really wants to hear from you. This is about you. This conversation is about you, and making sure that you spread the word to your family, to your colleagues, and refer to BWHI's Instagram account for more information. Also, we'd like to thank our sponsor, AbbVie, for their support in bringing this conversation to our communities. Now, let's get to our panel, because that's what you're waiting for. Our panelists have joined us this afternoon to address the unique impact of endometriosis on Black women and communities of color, to provide high-impact advocacy recommendations and resources, and grassroots implementation activities for endometriosis education and awareness for Black women. The women joining us today are health experts, they are leaders, and they are endo warriors themselves. And by the way, this is all about you. So if you've got questions, go ahead and put them in the chat. And when we get to the Q&A session of this panel today, we'll be sure to come back to those questions. We don't want you to have to wait the up to 8 years that it can take for Black women to be diagnosed. We want to make sure that you get this information today so that you can not just survive, but that you can thrive. So allow me to welcome our panelists today. Dr. Soyini Hawkins, gynecologic surgeon for the Fibroid and Pelvic Wellness Center of Georgia. Lauren Cornegay, who is going to join us with her beautiful picture, and she'll be listening in. Unfortunately, we're having some interesting weather here around the Washington area, and she's had some trouble piping in with technical stuff. So she's going to join us, and she'll chime in from time to time in the chat, and we'll find a way to bring her in. And our next panelist is going to actually be the person who helps to field some questions that may have been directed for Endo Black, of which Lauren Cornegay is the founder. Chantil Thomas Thomas has also done work with Endo Black. She is also an author and founder of Pretty Periods. And then we round this dynamic group out with Les Henderson, founder of Endo Queer and the host of To Be a Vegan podcast. So thank you all for being here today. We'll get Lauren in when we can. But Dr. Soini Hawkins, I want to start with you and let's talk about the basics here. What is endometriosis and what are the different types of endometriosis?
Awesome. Excellent question, Leslie, and a great way to start. Thank you guys so much for having me this afternoon. So endometriosis is actually a diagnosis that for a lot of women end up being a diagnosis of exclusion because of their pain. But pathophysiologically, meaning the actual root of the cause of the pain, is that endometriosis is endometrial tissue, which is the lining of our uterus that is in an ectopic or abnormal location. So it's somewhere other than the lining, and that could be anywhere in the body. The most common place for us to find endometriosis is in the pelvis, meaning it can affect the ovaries and the tubes. It could be on the surface of the bladder from the inside or the rectum and contribute to all of the symptoms that you just talked about. It could be on the diaphragm. Some patients even have chest pain and shortness of breath. It could be in their lungs. We've found endometriosis on autopsy in people's brains. So it can be literally anywhere in the body. The hallmark symptoms that many women will complain to their doctors about and unfortunately be ignored about sometimes is pelvic pain, pain with their menstrual cycles, but they can also have pain outside of their menstrual cycles or pain with intimacy, pains with using the bathroom and the things that you've already discussed. But endometriosis can be quite rampant. And like you said, it could be it could affect almost every portion of the woman's life.
Wow. I mean, from the whole body, endometriosis can impact the whole body. I think that's a real aha moment because I'm not sure that most people know that. When you think about endometriosis, you think about it being limited to the area that you talked about. I want to bring in Chantel Thomas, and she is the author and founder of Pretty Periods. And she's also done some work with Endo Black, which Lauren Cornegay founded. Lauren, talk to me about your experience with endometriosis and how your symptoms inspired you to start Pretty Periods. Obviously, we've heard Dr. Hawkins give the description of what happened, and you can certainly relate to that because that has been your experience.
Sure. Thank you so much for having me. I started Pretty Periods at the height of the pandemic while in quarantine. I was diagnosed with endometriosis in 2015. And like many women of color, like you just don't talk about certain things. And so there was like a shame and stigma that surrounded my diagnosis that was external, but viewed more internally, I would say. And so I was sitting home and I was just like, I have to do something. I'm a person who's a grassroots girl, and I just have to do something. And the stigma that's associated with one's menstrual, heightened with symptoms of endometriosis, they're not good. So I wanted to create and curate something that made Black women feel good about their bodies overall, and like take ownership, that the autonomy piece of what's going on when you're menstruating. And I thought of curating a luxury subscription box that featured goodies that just spoke to Black women. So it had locally sourced items from Black-owned businesses, including like a sweet treat. We started out with Partake. We used organic period products, as we know that period products tend to have an adverse, impact on our reproductive system with bleaches and dyes and so on. So I wanted to, use items that made us feel good and were good for our bodies, and expose women to that side of things that they may have not known about. You're just given some pads and like, hey, it's that time of the month, you use these. But I wanted to expose Black women of like all, spheres, like, hey, use these products because they're good for your body and they make you feel good. And then something that you can just relax, just dispelling that superwoman syndrome. This is your time during this month to be at peace, to be at ease, especially when you have a dis-ease such as endometriosis.
Let me follow up for just a moment, Chantel, because you mentioned that you were diagnosed in 2015. Did it take a while for you to be diagnosed, or did you
Yes.
Were you able to get that diagnosis soon? It sounds like
So
it took a
I
while.
always check boxes. That's a thing for me. And I recognize that I've always had access to care and I've always had access to optimal care, right? However, I always had like harsh periods. I can remember nearly failing PE in 8th grade because I refused to change up during my cycles as they were so bad. And I menstruated so heavy. And I would tell my PE teacher, I'm not doing it this week. And he would say, why? And I didn't disclose why, but I'm just not doing it this week. And when I did disclose, he's like, oh, nothing's wrong. Fibroids ran in my family. So it was just another thing. And it's just like, okay, you vomit, you're nauseous, you have pain, it's normal. And when I spoke to my physician about it, they were like, well, maybe you're not active enough, you know. And then I can remember sometimes like blacking out during my period because it was so bad. Yeah, I noticed that like around college, and they attributed that to stress. Finally, I was like, something is wrong. My parents were very supportive, and they like, something's wrong. We have to do something. So they started with an ultrasound, and then they were like, well, we didn't see anything really. My mom suggested following up with an MRI, and from there, I had my first laparoscopic surgery. 7 years later, I've had 3 thus far and 1 DNC. And last 2 weeks ago, I was diagnosed with fibroids, and I'm scheduled for another MRI within coming weeks because there's probably some endo, as I've been experiencing pain and heavy menstrual flow again after having my last surgery in March of 2021.
Wow, which speaks to the chronic nature of this, that this is ongoing and you've been dealing with it for a long time. Les, I could see you nodding when you saw Chantel talking about how difficult it was to access care. And then we think about you as the founder of Endo Queer, as a masculine presenting woman in the LGBTQIA community, trying to seek out care. And it was doubly hard for you to get people to listen, to acknowledge, and to even find a safe space to get to diagnosis. Talk to us a little bit about that part of your journey.
Right. Good afternoon, everyone. When I found out I had endometriosis in 2014, but I'll rewind. Kind of like what Chantel said, I had, just very rough periods I didn't really have anyone around me really conscious of all these type of things. They're like, oh, you just have, bad cramps. And then I lived with my grandparents as well as my mother. So it was a lot of old wives' tales. Like they said, well, stop walking around barefoot on your periods. Don't you need to sit in the bathtub on your periods instead of taking a shower, or you're eating too much ice cream and that's what's making it so bad. So, just little things, little wives' tales like that. And then of course, as I got older and I started getting out into the workforce and, of course, then I had to work. My periods were still they were really awful. And I had a boss one time just tell me to take 9 Anisons and get back to work. And, at that point in time, I was still maybe in my late teens, early 20s by then. So I just thought I just kind of had bad luck and I just had bad periods, not really thinking, a lot of it. But then as time went on, I'm like, okay, something's really wrong. And so when I would bring this up to various doctors, because endometriosis is still an illness that's still related more with femininity. So I've always been a masculine woman, tomboy and everything. So of course people are very taken aback sometimes when I would come into the appointments with this issue. And when my partner accompanies me to appointments, she's feminine appearing. So they automatically go to her and think she's the one that, needs the help. So just still going through little nuances like that. And then also when I go into the doctor, because a lot of statistics out there do show that many LGBTQIA plus patients have to educate their doctors, during the appointments. And it's like, we're already we're already exhausted just from, things happening with us in society, our intersections. And then already, because we're going to the doctor for a purpose, and especially when we're going in there for an illness, we expect the doctors and the medical staff to be knowledgeable, but a lot of times that's not the case. I've had a lot of doctors over the years say, well, you tell me, or what's this, or, what's going on with this, or let me, pull out the Google. So I do find myself in, educating doctors a lot during my appointments when I'm already frustrated. And then fast forwarding to 2016, I would experience my first lung collapse because, as Dr. Hawkins mentioned, endometriosis can spread like all over. And unfortunately, mine spread to my lungs. And I didn't know it at that time, because at that time when my lung collapsed, I was still a chain smoker. And so I just thought, okay, smoking all these cigarettes have caught up with me. That's what I originally thought. And so when I was after my first lung surgery, that's when the doctor came in and the surgeon came in with a OBGYN. And because I was menstruating during the procedure, so they were able to detect the endometriosis, in my lungs, from that. And it's still been kind of difficult because this is a chronic issue. I've had, not only did my lung collapse in 2016, but then I had another slight collapse a little after that. And then I had collapses in June of 21 and December of 21. So it's something that keeps happening. And I'm slated to have I'm slated, and this is depending on if I can do this before the lung collapses again, but I am slated to have hysterectomy later on at the top of the year. So I'm hoping that can happen. Originally, I was supposed to have it in January, but instead I was having another lung procedure.
Can you tell at a certain point, because you've been through this at least 3 times with your lung collapsing, is there something that happens before that happens? If there's someone listening right now, because obviously hearing that this can impact your lungs and that your lungs can actually collapse, maybe many people may be like me going, whoa, didn't know that could even happen here. Was there something you were feeling in your body before that happened?
That's the weirdest thing, Leslie. Now, the first time in 2016, it was during the blizzard that we had, the winter of well, not really a blizzard, but the snow that we had in 2016 here in the DC area. And so I was kind of being a fan of the snow, and I thought I had just overexerted myself. But then 2 days later, at a previous job, I was a conference. We had a hotel in downtown DC. And for those that are watching this, that are local, it used to be around Navy Yard. That whole area has changed, but it used to be a McDonald's kind of right there in that area. And so I walked from the hotel I was at to that McDonald's that's no longer there, but there at the time. And, just doing that, that really short 5-minute walk, I walked into the McDonald's and I was just so out of breath. I was panting, and I just thought I had overexerted myself. So I noticed I had to stop a lot when I was walking. Even when I was just sitting down, I was just panting. So that was one of the first signs that I felt. The second time it happened was scary because I didn't feel anything. Like, it was just a checkup originally from the first lung collapse. And next thing I know, the doctor says, okay, you have to go back to the hospital. Your lung has recollapsed. And then when it happened again, years later in 21, I originally had went to the ER for another issue the summer of 21, because I was having a lot of pelvic pain. And that's when they were like, oh no, how's your breathing? And I said, oh, my breathing's fine. They said, oh, because, we see that your lung has recollapsed again. You had another spontaneous pneumothorax. And I was like, wow, and so I didn't, that time was scary because I didn't have any issues with breathing. And then when I went in December to the doctor to get everything finalized for my surgery, that's when my doctor says, oh, well, it's going to have to be a delay on that because you've had another spontaneous pneumothorax. So that, and with that was kind of weird because I thought at first I thought I was just having maybe bad indigestion or something, and I was becoming active again since by the end of 21 we weren't, we were starting to kind of get out of the shutdown slightly.
Mm-hmm.
So I was getting back outside and doing things for work. So I was thinking, I probably ate something wrong. My body's readjusting to being back outside. But then so it was like a little bit of pain, but it wasn't like anything like drastic. But I will say for me personally, it was being very short of breath. Sometimes I could just sit down somewhere and just be in pain, or I would, so it kind of varies. It's scary.
It kind of varies
when you don't even feel it.
Dr. Hawkins, when you hear how Les has described how endometriosis has shown up in her body and all that Chantil has heard, it sounds like you probably get all of this, but you get it toward the end when people have been trying for a very long time to get answers. How do we get women who are impacted by endometriosis like Chantil and Les in to see a doctor like you before all of this happens?
Oh, great question. So the thing about it is, okay, so I'm a minimally invasive surgeon. I'll clarify that, meaning that I do and specialize in minimally invasive laparoscopic robotic surgery. I did a 2-year fellowship after my residency, specifically to treat women like Les and Chantel in a minimally invasive way, and in a very specialized way. I do excisional surgery for endometriosis, and I trained at a center of excellence. Some women don't even know there are doctors like me out there that are going to be very much specialized in this area and want to give them a very specialized care, which is appropriate, especially when you've tried several things and things have not worked for you. But I agree with you, Leslie. It would be lovely if I were able to meet patients a lot sooner in their journey when their stage of endometriosis might be earlier, or even before the symptomatology gets as bad as it has with things like spontaneous pneumothorax, which is life-threatening. So it's about education. It's about individuals knowing that they can seek a second opinion. Just because the doctor has been taking care of you since pup was, you were 2, doesn't mean that you can't seek additional resources and care, and also about education on the physician's part as well, that there are specialists like us that they could refer patients to, and I happily send patients back to their primary providers after I've been able to help them with this chronic illness that they have. So education is super important.
It's super important. We've heard commonalities between Les and Chantil's stories. They both talked about the really heavy periods, the pain around the periods, just the saturation. Obviously, Les talked more about how her lungs were impacted. And so we can see how the endometriosis travels. For Chantil, we can see how this is still manifesting because now she has fibroids that she has to deal with. So if you're someone listening today and those are your symptoms, but you're experiencing something else where you're not sure if it might be aligned with endometriosis, let's talk about some additional symptoms that should send up the red flag immediately, Dr. Hawkins.
Yeah, change. I like to express to women that if they feel like there has been a change in their body where they feel like this is new, this is different, this is not normal, that they want to question it. With that, also, you have to understand what normal is. You shouldn't be incapacitated where you can't make it to school or to work. You shouldn't be to the point where you are taking narcotics just to function, or where you're missing out on opportunities for intimacy with your partner, or road trips with your girls, or you're feeling like your process of symptomatology is impacting your calendar. You're scheduling everything around this 1 week of the month. That is not normal. And that's a very basic way to put it. It's not getting into the nitty gritties of how many days, how many pads, like what is your pain scale and pain threshold. That's different for everybody. But once you start to see those either changes, or you can actually notate to yourself, or even sometimes it takes family members and loved ones to tell us, baby, that's not normal. You shouldn't be going through it like that. Even if that is our family history, or how Big Mama had it, her cycles were rough like that. If you can identify that that is abnormal, in that, you should hopefully be able to feel comfortable to speak with someone about it, even if that's other community members, and working your way to a physician that's going to listen, hear you, and help you work with them to make some plan of action.
Chantel, can I get you to talk a little bit about the mission of Endo Black? And what I find that is a little bit interesting about this particular disease is how you refer to yourselves, not as a victim, but as an endo warrior. Why is that, you think, so important for people like you and Les and Lauren and the many patients that Dr. Hawkins sees? Is that about empowerment? Is that about agency? What about that term, you think, is so important for women going through this journey?
So first of all, Endo Black was founded in 2015, and it serves as a resource for Black women and women of color who are looking for resources as it relates to endometriosis and women's reproductive health. I can remember, like, when I first started my journey, I didn't see many women who showed up and looked like me, who were openly discussing what was going on with their bodies. I went on to Meetup and I said, I'll start something. There was no one there. So finally, I happened to stumble across Endo Black, and I must have bombarded Lauren with a ton of questions, a ton of ideas, and what I wanted to do. And she's my sorority sister as well. And so I was like, she's not going to just discount what I have to say. She's going to listen. And indeed she did. And I came on to do some development work for the organization. And it's a place of sisterhood, right? You can get resources. I think we have now over 11,000 people on the Instagram, and a community on social media collectively of about 15,000 Black women and women of color sharing resources, sharing their experiences when it comes to endometriosis, from our surgeries to providers to symptoms to any tools you need. It's a toolkit. It's a ongoing toolkit that just gets bigger and bigger every day. And I commend Lauren for being so courageous and taking that step and founding this space for us, because sometimes communities are intentionally overlooked. We know systemic racism plays a big factor in why we are underserved and underrepresented. And Lauren filled some big shoes when she created Endo Black. So there's a group me, there's a group chat, there's the Facebook, there's the website, and then she coordinates meetups, and she has ambassadors. Most recently, the ambassadors has scaled back to DC, Maryland, and Virginia area. When we first started out, they were national ambassadors, and she's going to scale up again. So make sure you guys are looking on the website for that opportunity to become an ambassador. But it was filling a space that was needed, because, as you said, we're warriors. And I try to take the whole superwoman and the strength of being a Black woman, that you just have to keep soldiering on. But in this case, you have to be your own advocate. You have to do a lot of educating. While you're also educating yourself, you're educating your provider, and you just have to continuously advocate, right? Sometimes your doctors may not get the right treatment plan. As Dr. Hawkins said, it's okay to ask for that second opinion. And that's what Endo Black is, right? It's that resource that when you're not quite sure, you can phone a friend, you can tag a friend, you can tag someone in and say, hey, what was your experience like with this provider? What question did you ask to get to the outcomes that you currently have? And that's that warrior piece. And so while it has a denotation and connotation that I may not necessarily agree with all the time, you have to just keep going. And that's where that warrior piece, comes in, because if you stop, you may not get the answers or outcomes that you desire. So Endo warrior, we also refer to each other as Endo sisters, because a sister knows your pain. They know your experience. They've been where you are. They can attest to your journey. And that's what I find more powerful than sometimes being a warrior, that I have sisters who are with me in this experience, in this struggle. And Endo Black kind of is the hub, or ground zero for Black women and women of color who are experiencing what we are experiencing. And again, I just give some kudos to Lauren for that.
That's a great resource. And I know, Les, you've talked about safe spaces and how you have had to work to create additional safe spaces for members of the LGBTQIA community who may be in need of specific help in terms of someone seeing you and identifying you as the person in need and being able to talk with you about how this is presenting in your body. So I'm curious about EndoQueer and your podcast and how your experience contributed to the founding of those resources.
Sure. And, as much as the pandemic has been bad for a lot of us, unfortunately, a lot of people have died and are still dying. And just a lot of people have really suffered during the pandemic. But it's like, on the other hand, I think it gave some of us time to actually be like, okay, I'm not commuting it. Well, if you were fortunate not to have to commute somewhere every day, and you were able to kind of have more time still and think of things. So I will say EndoQueer has been in the works even pre-pandemic. But once I was invited to it was a Black and Endo panel. I know Lauren was on it, and a few others were on it. That's when people just started emailing me, messaging me, saying, "Hey, I'm lesbian dealing with endo. I'm trans with endo." So people just started sharing their stories with me, and for a while I went through years of depression dealing with this. I was like, nobody wants to hear this. It's very depressing. But I said, you know what? I need to get out here and really share my story, especially after so many people have reached out to me after that virtual panel I was on during the pandemic. So that's when I really formed EndoQueer, because, the spaces like Chantel and like Lauren have are wonderful, but it was still, and other people have, it's wonderful, but it was still some people feeling not, feeling like they weren't, supported, especially those out there that, are not women, or people that are non-binary, and they, they don't identify as just a cisgendered woman. So I wanted to, although I do still identify as a woman, I know I'm masculine presenting. And for some people watching this program this afternoon, they're like, okay, you're just a girl that looks like a boy. But for some people, it's still hard for them to digest, okay, why you're going through this, why don't you just get scooped out? Another term for like just getting a histo. And, of course, every time I've tried to get one, my lung has collapsed. So it's been, just kind of complicated. But I just really wanted to have that safe space for other LGBTQIA plus people to be able to converse with each other. There's a private Facebook group. There's a resource page on the website where resources are consistently being added to it, because I just want people to know in the community where they can go. Like I said, I've been blessed where I found wonderful communities like Endo Black's been a spectacular community. The Pretty Periods is a wonderful community, and so many others. It's just been a wonderful, community. I just wanted to make sure that other people like trans and non-binary and even men dealing with endometriosis and other chronic illnesses have that safe space. And then with the Be a Beacon podcast, I wanted to share stories from people throughout especially throughout the LGBTQIA plus community of people of color. Sometimes with mainstream, and we're getting better with LGBTQIA media. However, it's still gaps there. So my goal is I just want to make sure a lot of people that their stories are heard and that their stories are told. So I like being able to get deep with people and, into their lives and what they're going through and how it helps others.
You want to be seen and heard in your full life experience.
Yeah,
which,
and
yeah, go ahead. Yeah.
And just, for us to continue to be able to take action, to continue to hold the healthcare systems and medical administrations, accountable for their actions and how we're treated across the board, whether you're, a person of color or whether you're LGBTQIA plus, it's still those gaps there. And that's why we're all here, to continue to make sure that everyone is getting the care they need, or that these healthcare systems get better, because it's a must. Because when the medical professionals have bias, that means there's so many people here dying unnecessary deaths. They're not properly getting treated because of their bias. So, that's why we're all here today, because we have to continue to work towards that. And all of us as patients and all of us as health advocates, we have to continue to hold these healthcare systems accountable.
The bias and the disparity gaps that all of you have referenced clearly have a role in how you are diagnosed or not on your journey. Dr. Hawkins, does that bias and disparity gap also impact the kinds of options for treatment that women of color are offered or
Absolutely.
or are even available to them because they are diagnosed so far into this process? I mean, in the case of Chantel, she's got stage 4 endometriosis.
Yep, absolutely. That's exactly right. And that's exactly why, almost like we think about with cancer, when we're able to diagnose earlier, so the sooner we can get diagnosis, the more potential options and opportunities there are for treatment. And the even theoretically, potentially the better the patient will do in the long term. The less surgeries they might have to have, the less medical interventions with medications they may have to have, the less impact. So the fact that traditionally, because of those biases, African American women and women of color, period, are getting diagnosed later because their pain has been attributed to everything else, right? Or they have been ignored in that pain because they should be able to power through it or be a superwoman that Chantel just mentioned. They're losing opportunities every step of the way. On average, it takes 7 to 8 years for most women to get diagnosed with endometriosis, even longer when you read some of the sources for a Black community. So that in and of itself, we're being told we have PID, we're being told it is, some type of dysfunction of just the shape and the anatomy of our uterus, which can be quite ridiculous. And that is unfortunately allocate into missed opportunities for our communities. Absolutely.
I
You're
want to
hitting on the head.
I want to mention to everyone that this is your conversation. And so we want to make sure you put the questions that you have in the chat, and we're going to come back to them, in about 10 minutes or so, and start to answer some of those questions. I can see some of them are starting to come in, so that's great. But I want to make sure everyone who has a question has an opportunity to at least pose it. Dr. Hawkins, before I move on to Chantel and Les again, I just want to know, you're a surgeon and you get people coming to you at the last possible solution because it's taken so long, but we don't want that to continue to happen. So if you are a Chantel or a Les and you're in the beginning part of this journey and you've got a doctor who is not listening to you, or maybe not um, appreciating the level of pain or experience that you're going through, what do you do in that office? How can you, if you're feeling some of these symptoms, get your answers sooner? What do you say? What do you do?
One, don't be afraid to advocate for yourself, meaning that you are giving your full story and journey, even though they might have slotted you for 15 minutes and it may take several visits to get all of it across. Definitely tell your story and all of your symptomatology, because sometimes if we don't know, then we're limited. Right? We don't know that you have pain with sex or that you have blood in your stool. Then I might have sent you for a colonoscopy, but if I don't know that, I can't put that into the potential options. If you feel like your doctor, again, is not consistently offering you treatment, but even before treatment, a way to diagnose, like you haven't even gotten an ultrasound and you have heavy cycle or pelvic pain, that is a red flag. You need to run out of that doctor's office and find another one. Go to resources like Endo Black and find out where are the doctors in my community that can be helpful. And then furthermore, don't be afraid to educate your doctor. We've heard this from both of our advocates here. Sometimes it is okay to say, okay, I have read that maybe this could be endometriosis. What do you think about that? Maybe my pain isn't just that cyst on my ovary or the polyp in my lining. Maybe I have endometriosis because it's cyclical. And that sometimes is don't be afraid to do so. I know that, yes, on the other side of the table is who has the degree, and really, honestly, you should not have to come in and educate your doctor. But in this day and age, with Google and with all of the resources and literature that we as patients can help empower ourselves, don't be afraid to do that. And again, I will very much stress, get a second opinion. It might not get you to me, You might not be ready for me in your journey, but I would say that even though I'm a surgeon, I've seen many, many patients that have chronic pelvic pain for a number of different reasons, and surgery is not necessarily where I'm taking them immediately. Sometimes it is important for me even to rewind the story and say, okay, well, have we talked about this? Have we thought about this? Maybe it's not even endometriosis. Maybe you have pelvic congestion syndrome. Maybe you have Crohn's disease. Maybe you have something else. Unfortunately, because it is a diagnosis of exclusion, there sometimes are other things that even in our own education, we might bottleneck and want to make endometriosis the, kind of the scapegoat for everything. I also don't want to miss cancer. I don't want to miss other
Sure.
things that could be causing pain. So advocate for yourself, educate your doctors. Don't be afraid to, and seek a second opinion if necessary.
Chantel, I know you're speaking on behalf of Pretty Periods and your own experience, and also Indo Black. If women are joining us today, if people are joining us today and finding about this space for education for the very first time, there's a meetup and there's a fundraiser coming up as well that may be beneficial, right?
Yes. So Endo Black has a meetup. It's going to be in the DC, Maryland, Virginia region. And the meetup is going to be on the 20th. It's in Maryland, Suitland, Maryland, I believe. And you can go on Endo Black website to actually get your tickets for that. We're going to have some local vendors from the area. If you're coming from out of town, it may not be too late to get a table so that you can, vend for some of your products. We love a good product. Also, the gala, it's our first major fundraiser event coming up in October, and it's Howard University's homecoming weekend. But listen, I'm setting that aside, and I'm going to support my Endo sisters so that I can show up. And we're currently looking for sponsors, as the organization recently received its nonprofit status. And so, as we all know, that funding is imperative and very critical for organizations just starting out. So if you feel like you can be a sponsor, please go to the website and connect with Lauren so that you can become a sponsor. They have options for like monthly giving. You can be a one-time donor. But if you want to support this gala, it's going to be a yellow tie affair. We would love to see you in the place. October 20th in the DC area. Bring out your best yellow and meet us there. Tickets may have gone on sale already, or they may be up for grabs soon. You don't want to miss that. But if you can support the agency in any way, I'll say like Endo Black has been a lifeline for myself. And though I have my own organization, I probably chat with Lauren all day. Throughout the day, most times, whether it's like AKA business, whether it's just being a friend, I can honestly say Lauren has become my sister and my friend through this experience. And I'm so grateful for Endo Black. So make sure that you're following them on all channels. And more than anything, like make sure that you're giving, because we're up against other bigger organizations. And sometimes we don't get the shine that we necessarily need to provide tools to people who are in need, right? And so I just encourage you to follow them on their site and, track the journey. And you show your support. It can just be sharing a post if you can't financially give. It could just be, supporting other efforts that they have going on.
And I should ask you, Les, as well, for Indo Queer, in terms of people who may want to be part of that safe space. How do they find you, and what should they do?
Absolutely. It's at EndoQueer, and I guess I can chat it here in the comments. It's at EndoQueer, and I'm on all of the social media platforms. You can even send a request to be in our private Facebook group. Also, I have a Substack. We have a Substack as well, and there you can get the newsletters that we have. You can find more information about the things that we have in our EndoQueer shop, and the proceeds from that, a percentage of the proceeds from that does go back into the LGBTQIA plus community, because there's so many people that are in need. And I'm very fortunate as I continue to build EndoQueer that I have a day job, and I feel very fortunate because a lot of people, not a day goes by that I'm not online or somebody doesn't message me, needing me to cash app them or asking people for help just to get something like lunch or dinner or something. So, it's still those needs. And some people can't even go to the doctor, or some people can't really go to good doctors in the community. And I've been there. I've had Medicaid. I've had no insurance. I've been there. And so to already deal with these intersections and deal with the challenges of society, plus dealing with the bias sometimes in the medical community, it can be a lot. And then just so many, and with so many people in the community not being able to have life's essentials, it can get frustrating. I know during my very dark years of depression after my first lung collapse, I was kind of like, the heck with it. I'm just going to let nature take its course. But I knew that deep down, I didn't really want that to happen because everything had just became so frustrating. So yeah, definitely follow Endoqueer on all of the social media channels. Subscribe to the Substack, which I'll put in the comments. You'll receive the newsletter, and definitely check out the shop. There's something I guarantee for all of you watching this program or that will watch this program. And then a percentage of those proceeds will go back into the community for those in need.
Those are great information, great resources. And Lauren with Endo Black also reminds us that advocacy is key. There are some questions for all of you, and I'm going to transition into that period right now. And one of them is, will a partial hysterectomy help with endometriosis pain? Dr. Hawkins, I'll pose that to you. And I'm struck by Les saying she's been trying to get this hysterectomy, but her lungs have been failing, and so she's been unable to do that. So or if she was able to get that hysterectomy or even a partial hysterectomy, would that help with endometriosis pain?
Sure. So a partial hysterectomy in our terms from a medical standpoint means that we're leaving your ovaries intact. And as we know, endometriosis is hormonally sensitized, as is many, many afflictions of women, fibroids, PCOS, all of those things are very much contributed to by hormones. So leaving your ovaries intact is what we consider to be a partial, or what most people consider to be a partial hysterectomy. It's actually a total hysterectomy. Hysterectomy has nothing to do with the ovaries. But for all intents and purposes, it used to be a period of time where we felt for patients with endometriosis, we needed to take everything. The uterus had to go, the ovaries had to go, they had to be completely cleaned out. That is not the thought process now, and research has shown that we can leave those ovaries and leave these women intact and not hormonally completely done in postmenopausal at very young ages sometimes, and still very much improve their quality of life in regards to their endometriosis and their pain. So removing just the uterus can be extremely helpful, potentially even curative for women with endometriosis. And I say potentially because you all hear about women who've had hysterectomies and still have significant pain. The pain could be because they went to a physician that does hysterectomies but doesn't take care of endometriosis. And so therefore they didn't remove the endometriosis that is on the rest of their pelvis and body and left the ovaries that are sensitizing it, right? So your best bet, if you do want an endometriosis, is to go to a specialist or someone that is going to give you that specialized care and remove all of the endo, not just your uterus. So the hysterectomy is actually the lesser part of that surgery. You need to be cleaned up. All of that endometriosis needs to go. And then the benefit of removing the uterus for someone like Les is that now she's dramatically decreasing her chances of implantation of new endometriosis lesions because you're removing the endometrium, which is where endometriosis comes from. But if they leave endometriosis everywhere, that pain can persist. So it potentially has great benefit to many women, but they want to be careful in choosing that route and thinking it's going to be completely curative, because it's not just that. It needs to be very much comprehensive.
Chantel and Les, have either of you tried pelvic therapy? And if you did it help with the pain? Chantel, you want to go first?
That was one of the first recommendations that from my first surgery. And I would say yes. It helped with the pain. As I said, I have access to great care, and like my surgeon specialized in minimally invasive surgery, Dr. Gabby Mawad, and he is phenomenal. And I would say it helped. I don't know. My body's just crazy like that. It came back within 2 years of my first surgery, and it was stage 4 again. And then my third surgery, stage 4 again somehow. And so I try that. We've done diets. I find that when you have endometriosis or chronic illnesses, first thing people say is, have you tried X, Y, and Z? And it's yes. So I'm always cognizant of when engaging a person on how we show up and what we say. Maybe Lena's what have you tried? But I would say pelvic therapy, even helping me use the restroom properly, and for intimate encounters, pelvic floor therapy has worked wonders, and I do recommend that. I also recognize that some people may not have access to that type of care, given your insurance, right? You may have like a copay that's crazy, or your insurance may not cover it all. So I just want to be cognizant that that may be a route to take. However, it may not be accessible to everyone. And we talked about equity kind of a little bit, but like that's one of those equitable pieces that like we need to just like, you know, level the playing field when it comes to the access, the level of access that people have to various types of cares to treat endometriosis. But long story short, yes. And then we spoke on hysterectomies. I find that that's one of the biggest things that doctors may lead. So if your doctor just drops that right away, I would just be very cautious and cognizant and maybe go get a second opinion, because like myself, endometriosis has impacted my fertility, and I'm still in childbearing age. And I had 2 doctors say, why don't you just get a hysterectomy? Why don't you just get a hysterectomy if you want it all over? Or why don't you get pregnant, as if that's going to cure it? And no, that's just not going to cure it. I still, and maybe I haven't, well, earlier I didn't think of freezing my eggs and things like that. But now that I'm older, like those options are like, you know, like in view. But like hysterectomy is something Les going to attest there. They throw that on you when you're probably first diagnosed as like an easy way out. So
now,
we've got 10 more minutes. So I'm going to have Les, I'm going to have you answer this question also about the pelvic therapy. And then I'm going to try to get a few more questions in here before we go. Go ahead, Les.
Yeah, well, first now as far as the pelvic therapy, I had that recommended, and that has been very helpful. Now, when it was first recommended to me, my insurance wasn't that great, and the copay was just, like Chantel said, it was just very expensive at that point in time in my life. And so that's when I found the sliding scale therapist that had helped. And they also gave me like at home, like techniques that I could do and I noticed that's been helpful, even me working out. And I'm not saying that's for everyone, but that's been, and personally for me, that's helpful for me with pain management. And I'm not saying this for everyone, but me, since because I used to drink a lot, but I noticed when I cut back on liquor, not beer especially, but liquor, I noticed my flare-ups haven't been, as bad. And I've cut back a little on dairy and all that. So that's been, and just getting a little more, eating more consciously has helped me out. And then I wanted to say like what Dr. Hawkins and Chantil said. Now, ironically, when I first mentioned a hysterectomy, this was way back in my 20s, I had doctors said, oh, you might change your mind, or they've said, you may change your lifestyle. And for me, it was just like, I've always known, like, I love children, but I'm not necessarily interested in having them. And then I had one doctor say to me, and by this time, I probably was in my late 20s, like, I'm not giving you a hysterectomy. I know what you're going through. Take this Lupron shot. And, after that, I just really began to advocate for myself. So I used to just be like, whatever the doctor says, okay, what do I know? They're the educated ones. So definitely if something doesn't feel right, like they both said, just keep going, keep finding, find other doctors.
Dr. Hawkins, so there's a question here about, can you explain how endometrial cancer and endometriosis relate, and whether people with endometriosis are at risk of getting cancer at a certain stage? What do we know about that? And what do we know about ways to avoid that outcome?
Sure. We don't know enough. Honestly, unfortunately, more research needs to be done, especially in that arena, and how the two have true relation. Because again, the thought process for a long time is that there was not a relationship between endometrial cancer and endometriosis. And we found in more recent studies and research that there is potentially, and it's relational. It's not necessarily that it's definitively causative. So I actually encourage my patients to not live in that fear or live with the anxiety that because they carry the diagnosis of endometriosis, that they are at an extreme risk of endometrial cancer beyond the general population. There's still more research that needs to be done to get that causative understanding. Were the individuals that had both of the diagnosis more susceptible to endometrial cancer anyways? Because endometrial cancer has many risk factors: diabetes, hypertension, extreme obesity and things of the such. So a lot more research needs to go into that specific question to get better answers. But again, I encourage my patients to not live with the anxiety or trepidation that that is their fate, because it is still quite rare, that association between the two. And it's not specific to any stage particularly. More research needs to be done to get a better answer to that question.
What are your thoughts about having an Endo tribe? How important is that, Chantel and Les? And we'll probably wrap up with these last questions here.
Sure, I would say having a tribe is essential to your outcomes. Someone who you can tag in, as I said earlier, someone who you can share your experience with and get resources from. We're always constantly going back and forth about how our experiences are, what part of our journey we're in, what are we missing. We support each other. So I sponsored a documentary for masculine-centered women to discuss their nuances around their periods, which I incorporated Laz in. We're constantly tagging each other in and making sure that we all are seen, right? I think that's very important that we elevate each other because this is not like an equitable field that we're in. So we have to make sure that we show up, create space so that we get what's needed. Because if not, then they'll think our silence that we're enjoying it, right? No, we're not. It's called the silent, disease. It's nothing silent about us. We're constantly making noise. So for them to refer to endo as like, oh, it's silent, I don't get that, because we're constantly here. And so having that tribe has made all the difference, because I can say, hey, what happened when you went to your doctor? Okay, so I need a journal. Lauren created a journal so that I can log my symptoms, that I can have a place to keep what's going on in one location. It's just that network that you need to thrive.
Unless you would probably agree with that, yes?
Oh, absolutely. Because, when all of this first happened, I felt alone with my intersections dealing with this illness. But then but when other people started reaching out, and then I connected with Chantel and Lauren, who they've just been phenomenal and very helpful. And so they and other people have just become part of this tribe, for me, and I'm glad that I was invited to this today, because I've been in some community spaces where it's like, although for me, I'm still a Black woman. Yes, I look masculine, but at the end of the day, I still personally identify as just a Black masculine woman. But I've still been excluded from certain spaces because they were like, oh, well, some of the ladies weren't comfortable, or, it was just, or either if they didn't say anything, people were still kind of uncomfortable. So, and then just to connect with trans people dealing with endometriosis, men that are dealing with endometriosis, it's very important for us to all be connected and not separated during this time, so that we can continue to check on each other, and so everyone will know that they're not alone.
Dr. Hawkins, I'll give you the final word for an online resource. I know we've got Endo Black, we've got Pretty Periods, we've got Endo Queer. Last thought from you about a great online resource.
So those actually are my online resources as well.
Ah.
Absolutely. I adore these ladies, and I adore everything that they're doing in the face of advocacy for women that look like us, that speak like us, that hurt like us. And I'm extremely honored to again have been invited to be included in this panel. But those are my resources. And I tell patients, Google. I'm not a pediatrician, so if something's wrong with my children, please believe I'm going to Google. No doctor is going to tell me I can't educate myself and find out more. So the resources are endless, but that is my tribe as well.
Well, thank you so much, Dr. Hawkins, and to Chantel Thomas and Les Henderson and Lauren. We know you're there in the chat. We wish that you had been able to come on here, but we can feel your presence and spirit. And clearly what you have created through Endo Black has been impactful. So thank you all for being here, for sharing your heart, for sharing your experience, your resources. And I know that someone's life will change because of the time that was spent here with all of you today. So thank you so much. And thank you for joining our webinar today. We hope this has been both enlightening and insightful for you, whether you've been on the journey with us today, right now, or whether you're going to watch this at some other point. We're going to put this on YouTube so that you can share it with your family, your friends, your colleagues, anybody. As Chantel says, this is not a silent disease because people are speaking up, and you can add your voice to this as well. So on behalf of the Black Women's Health Imperative, we thank you for being part of Be in the Know, Centering Endo, this webinar. And don't forget, this continues tomorrow. The Be in the Know Twitter chat is tomorrow starting at noon Eastern Standard Time on the Black Women's Health Imperative Twitter account, which is at BLK Women's Health. You can join that Twitter chat to continue this conversation and give your take on the impacts of endometriosis. If we all come together, we can make a huge difference. So thank you for your time this afternoon, and we hope you have a great day.